Here, as you see, there is no damage in the cartilage. After the disease takes over, some damage can be seen. First, the cartilage gets soft and then cracks, and its density reduces, as you can see here. After a while, when the cartilage completely disappears, the bone under the cartilage starts to show up. When the disease grows even more serious within many years, the whole joint starts to get affected. Of course, along with this during movement, the two bones rub each other. This causes the pain. Also, around the joint, some new little bones emerge like this. Osteophytes, as we call them, like a horn. These little bones disturb the patients to a great extent and causes strong pain during movements. In case of arthrosis, the cartilage tissue is degenerated. These degenerated tissues are covered and replaced with metallic implants, meaning we remove the diseased cartilage tissue here and replace it with implants. This is applied to both tibia and femur bone the same way. In between, there is a plastic material called polythene. This material prevents the two bones to interlace. This way, we provide the regular knee movement. When we are performing this surgery, we only cover the tips of the bones. We do not touch to any other surrounding tissue, the muscles or tendons. For that reason, following the surgery, the knee regains its regular movement capacity with the help of a good rehabilitation. The period of usage for a prosthesis done properly is between 25 to 30 years. Here the important thing is a proper application. You know, this is a very gentle surgery. This way the life cycle can be very long. But if there is something wrong during the operation, then there may be prostheses which only survive 10 years. The duration of the operation is 45 minutes. The entire surgery finishes in 45 minutes. If the patient has the problem on both knees, we can treat the two knees within the same operation in one session. That day we have them rest and the next day they stand. The older, overweight patients may have few steps. But for those with a fit body and at a younger age, they can even walk inside the room the very same day of the surgery. It is enough to hospitalize them for 3 to 4 days. Later, we discharge them and the rehabilitation continues at home. After 3 or 4 weeks, the patients come for their checkup here to my office without using any help or support. 4 weeks is enough. Well, our complication rate is 1 or 2%. When the surgery duration is short and is done with experienced, specialized teams, the chances of having an infection is very low. Among my patients, I never encountered any cause of infection.